Good morning, ladies and gentlemen. The work we are honored to present to you is titled Séroprévalence of Hepatitis D virus in patients who are chronic carriers of the HBs antigen of the hepatitis B virus in Abidjan from January 2017 to August 2021. This presentation will be made based on the following plan. We will have the introduction followed by the methodology, then we will discuss the results, and finally we will conclude. As introduction, we can say that viral hepatitis is a public health problem. There are 5 types of viral hepatitis, classified from A to E. Among them, there is the hepatitis delta virus, a hepatitis B satellite virus. The hepatitis delta virus infection is considered to be the most severe form of acute or chronic viral hepatitis. In the world, there are 10 to 15 million people infected with the hepatitis D virus out of all the chronic carriers of the hepatitis virus. In West Africa, an area with high endemicity, the seroprevalence of the hepatitis delta virus is estimated between 7% and 33% in people infected with the hepatitis B virus. According to the WHO, the overall information on the geographical distribution of the hepatitis delta virus serology is incomplete because there are few data or few studies carried out in the countries of these infected areas. Here in Cote-D'Ivoire, there is a lack of data on seroprevalence of the hepatitis delta virus. However, a high prevalence of the hepatitis B virus in Cote d'Ivoire with a rate between 8% and 12%. This can cause a high risk of co-infection of the hepatitis delta virus to hepatitis virus B. With a high rate of hepatitis virus infection in Cote d'Ivoire, the state of Cote d'Ivoire has aligned itself with the WHO goal of eliminating viral hepatitis by 2030. In addition to this, it gambles on the population not knowing about the hepatitis delta virus, which has a low demand for the screening of the hepatitis D virus in specialized centers in Cote d'Ivoire. What you need to know is that infection with hepatitis delta virus or hepatitis D virus could change the normal course of infection of asymptomatic hepatitis B virus to a chronic hepatitis, which could lead to cirrhosis of the liver or hepatocarcinoma, thus causing the death of the patient. The goal is to have a better management of patients infected with hepatitis delta virus. The objective of our study is therefore to determine the seroprevalence of the hepatitis delta virus infection in a cohort of patients who are chronic carriers of hepatitis B virus antigen, HBs, in Abidjan. The material and methods are presented succinctly. This cross-sectional retrospective single-center study involved in patients infected with hepatitis B virus who came to CEBA during the period from January 2017 to August 2022. The study population consisted of the 130 chronic hepatitis B virus carriers who came to CEBA for hepatitis delta virus diagnosis. Image 1 shows the method used to complete our study. This involves the collection of patient samples using 3 EDTA tubes. These tubes were centrifuged, alipos were collected, and these alipos were kept at -80 degrees for biological analysis. This biological analysis concerned the hepatitis D viral load, which was carried out on Cobas Stackman. Cobas Ampli Prep from the Roche company. The diagnosis of the hepatitis delta virus was made on of the Burette company. And the titration of the HBs antigen was carried out on Cobas 411. Table 1 presents the socio-demographic and histological characteristics of patients infected with the hepatitis delta virus. The seroprevalence of the hepatitis delta virus is estimated in our study at 7.89%. 7 of these patients were men and 3 were women. 70% of the men represented people infected with the hepatitis delta virus in our study. The average age of 45 years. The median viral load was 83 turn IUML, and the quantitative antigen was 32,725 IUML. Image 2 shows the seroprevalence of the hepatitis delta virus and TB in our study. Our study deduced that 7.69% of patients infected with hepatitis B virus were co-infected with hepatitis delta virus. This rate can be superimposed on several studies carried out by Lionel Fabian and collaborators in 2013, as well as by Dermata and collaborators in 2015, which found a rate between 5% and 20%. However, this rate is high compared to the WHO rate, which is estimated at 5%. Thus, this study has a low prevalence compared to the rate achieved by Sevede, Dauda, and collaborators in a study carried out in Abidjan in 2018. Image 3 presents the percentage of patients infected with the virus hepatitis delta according to gender. These results are consistent with those of Nwoketuko in Nigeria in 2009 and Asma in Ghana in 2014. Contrarily, Sevede Dauda and collaborators in a study carried out in 2018 found a predominance of women infected with the hepatitis delta virus in their study. To conclude, we can say that this study allowed us to describe the seroprevalence of anti-HDV, which is estimated at 7.69% among chronic carriers of HBs AG. It also helped us confirm the presence of the hepatitis delta virus in NHBs AG carrier patients at risk of developing serious forms of viral infection such as cirrhosis of the liver or hepatocarcinoma of the viral liver infection. Thank you, ladies and gentlemen.